How well do you work with a patient's medical providers? I'm Dr. David Graber with the Association of New Jersey Chiropractors with another practice tip. With me is Dr. Jeff Langmaid, the evidence-based chiropractor and also the Smart Chiropractor Service.
Yep.
And Jeff, a lot of doctors, chiropractors, the patients have doctors, sometimes multiple, and they're all taking care of them.
Right.
A lot of chiropractors want to know, what should I do, or how can I best outreach and actually communicate with these doctors?
Yeah, there's a couple of ways. That's a common issue. A lot of chiropractors practice on an island, and there are a couple of key benefits to reaching out to the other healthcare providers. Number one is to build your referral network. Find out who do you know, trust, and like, who are going to be your dance partners for other healthcare professionals in your community. The second aspect is to show off the results that your patients are getting. It's so important. Now, as far as a strategy to do that, we look at it through the lens of doing three specific things. Number one is sending case notes or updates every time you do an examination or an evaluation. That gives the opportunity to showcase co-management, show those results, and keep the other docs appraised of the care. Number two is to update them with research updates. That helps keep you top of mind, helps position your practice. And then number three is pretty obvious, but get out there and meet them. Take some meetings, have conversations, understand who are they seeing in their practice, and if there's overlap with what you do in your practice. There could be potentially great synergy, but it takes a little time to find those people, and to me, it's the best way to have a good patient-centric approach to care. Now when your patient comes in and maybe they don't have a primary care doctor, which is common, or they're looking for a different form of a specialist, you don't leave it to chance, but you can play a little bit of offense and defense and direct them to somebody you know, trust, and like, somebody you have a relationship with, and somebody you expect them to get great results with. So those are what I would say. If docs out there, and I'd encourage everybody, want to reach out and bridge that gap, those are a couple action steps they can take.
That's great. That's great. One follow-up, because I know a lot of doctors are hesitant. Like, what would you do first? Would you send your case notes first, send research, just go right out and meet them? And do you meet them, or do you contact their receptionist and have or your receptionist buddy up with them?
Yep. The first step in the process is to build your target list. You need to know who you're going to reach out to. And the way to do that is to make sure you are collecting the primary care doctor information on every new patient that comes into your practice. I recommend 2 steps to do that. Have it on your intake forms. Usually that's going to get you about a 50% collection rate. I want you to be at 90. So when you notice it's blank, just make sure you ask the patient, hey, I noticed you left this blank. We love to have that information to communicate and coordinate your care. That question alone will get you up to 90%. Once you do that, you're going to have a great idea of who you're co-managing with. These are the people that you're actively co-managing these patients with. Those are the perfect people to put on your list and start getting those case notes out to.
Excellent. Excellent. Thank you. This is Dr. Jeff Langmaid, the evidence-based chiropractor. You can find him on Facebook. He's got a blog. He's got a great podcast, Real Quick Ride to Work. Thank you very much.
My pleasure. Thank you.